The presentation comes to you from the PhD category. As we all know, the prevalence of tobacco abuse in smokeless and smoking form is increasing, with at least 1 billion smokers worldwide and minimum 700 million breathe air polluted by tobacco smoke. Harmful effects of tobacco habits to the extent of oral cancer are well known, but its effect on dental caries is worthy of investigation. Also, the tooth decay is the most common multifactorial chronic disease, resulting in the substantial morbidity and influenced by salivary factors. Saliva itself is a multi-constituent oral fluid that can be collected through non-invasive means and has influence in prevention of dental caries. Saliva plays a major part in the health and it changes its quality and quantity may alter the oral health status. That's why this study was planned for the comparative evaluation of salivary parameters in tobacco abusers. As we all know, the tobacco abuse influences dental caries by increasing cariogenic flora as well as by decreasing salivary flow rate. Salivary constituents also help in remineralization of the incipient caries regions. Thus, tobacco abuse has huge impact and it's unclear how it influences and it's unclear that how it influences the dental caries. Protective potential of oral cavity is basically maintained by saliva but is disturbed in dental caries. Hallmark of dental caries is demineralization. Understanding all this tobacco abuse, role of saliva and dental caries will influence of tobacco in dental caries will limit the overall disease burden. Research hypothesis: there is variation in the salivary amylase and calcium, phosphorus, IgA, flow rate, and pH among tobacco abusers to those of non-abusers with different caries status. The study was planned with the aim to estimate and compare alpha amylase, calcium, phosphate, IgA, flow rate, pH, and protein levels of unstimulated whole saliva in tobacco abusers to those of non-abusers. The objectives were to categorize the participants into tobacco users and non-users, into no caries, moderate caries, and severe caries status in adults aged 20 to 50 years. Further, to estimate various salivary parameters like alpha amylase, calcium, phosphate, IgA, flow rate, pH, protein in unstimulated whole saliva of adults in all the groups, and then to compare these parameters in with and without use of tobacco abusers with different caries status. Coming to the methodology, study was conducted only after taking the institutional approval. The participants for the study had selected by calculating the sample size formula and there were 135 participants in each group. These are the pics of the oral hygiene status and caries status of the few tobacco abusers. Following were the inclusion and exclusion criteria, such as inclusion criteria basically included the use of tobacco product at least in 6 months, age range were from 20 to 50 years, 28 teeth only dental subjects were enrolled for the study, and the participants were permanent residents of the village consuming municipal water. Occasional tobacco abusers or those who are not ready to give consent or participants with the systemic illness were considered for the exclusion criteria. The participants were informed regarding the study through participant information sheet. Participants were informed consent form was signed by all the participants. This is the routine saliva collection protocol, which was followed for the collection of unstimulated saliva till 2 to 3 ml of saliva was collected by spitting method. Data obtained from 135 participants of tobacco abusers and those of non-abusers, so total 270. They were categorized into no caries, moderate caries, and severe caries. The collection of unstimulated whole saliva was done by spitting method. Parameters analyzed were alpha amylase, calcium phosphate, IgA, flow rate, protein, and pH, and results were subjected to the statistical analysis. Coming to the observation and results, this table shows the various parameters of alpha amylase calcium phosphate in no caries, moderate caries, and severe caries. Alpha amylase mean was increased in severe caries, whereas calcium amylase mean was increased in severe caries but control group. And phosphates were increased in severe caries but again in the tobacco abusers. So thus amylase and phosphate was increased but in tobacco abusers and not in the control group. The levels of protein, IgA, pH, and salivary flow rate. We can see here in no caries group, the tobacco abusers mean was higher for protein as compared to moderate and severe caries, whereas IgA mean was higher in severe caries in tobacco abusers. pH and salivary flow rate, IgA, all were in the decreasing order in from no caries to severe caries, that too in tobacco abusers. This is the mean salivary alpha amylase, which is higher in the control group, which is higher in the tobacco abusers as compared to control group. Mean salivary calcium was again higher in the control group than the tobacco group, whereas phosphate was higher in the severe caries in the tobacco abusers. Salivary protein was higher in the tobacco abusers but in no caries group, whereas IgA was in decreasing order from no caries to severe caries and it was least in the tobacco abusers. Salivary pH was decreased in the tobacco abusers in severe cases. Also, the salivary flow rate was reduced in severe cases in tobacco abusers as compared to the control group. So these are the various salivary parameters showing the comparison in tobacco abusers to non-abusers by Mann-Whitney p test, where if you can see the mean salivary amylase is higher as compared to non-abusers and the difference is statistically significant. Calcium mean level was higher in case of tobacco non-abusers and the difference was not statistically significant. Phosphorus and protein again were higher in tobacco abusers as compared to non-abusers and the difference was statistically significant. IgA level, pH and flow rate were decreased in tobacco abusers and hence higher range was seen in non-users and the difference was statistically significant. Coming to the discussion, as we can see here, the mean age of the participants was 41.77 years with the DMFT of 3.73, which was in accordance to the study of Rubeneta, but they had higher Verdon as of the Indian national average of dental caries, that is 42.24 and DMFT of 1.39. Studies done by other authors like Shakin, Tanaka and Ruben had compared here. The dental caries prevalence was also correlated with the oral hygiene index and it was statistically significant in non-users. Shakin et al. Reported that the smoking homes had significant higher prevalence of dental caries compared to non-smoking homes. Tanaka et al. Has reported that the household smoking might be associated with increased prevalence of dental caries in children, whereas Ruben et al. Observed that the physical neglect of oral hygiene measures and increased incidence of dental caries in the psychoactive substance abuse. The prevalence of dental caries among smoking and smokeless tobacco abusers showed that the tobacco habit is a risk factor for increased caries activity and it was found higher in smokers as compared to smokeless tobacco chewers. In our study, as is shown here, the Asen et al. Amylase was higher in our study and the similar values were reported by Asen et al. In 2009, whereas Ganger et al. Has reported the reduced amylase activity in tobacco smokers. Amylase alpha 1 gene copy number variation and dental caries experience was reported, where they found the increase in the amylase as the caries are increased. Thus, alpha amylase is exclusively of salivary origin. It basically cleaves alpha glycosidic linkage in the starch and glycosid. It also dissolves the starch containing food debris written around the teeth and the oral mucosa and has important bacterial interactive function. Edmir et al. Have compared the salivary composition is not affected by smoking, whereas McGregor et al. Mentioned that the salivary calcium concentration increases in plaque, and Khan et al. Also mentioned that it increases in the smokers. Gandhi and Amle et al. Has mentioned that the phosphates are less in caries free, whereas Sharabi et al. Has mentioned that the phosphates were higher in caries-free group than the other groups. Now, this is the chart where we can see the demineralization effect. This diagram represents the calcium and phosphate release and the process of demineralization. This direct relation of calcium with increasing caries status was attributed to calcium tooth release and redistribution from the demineralization of tooth. Phosphates basically acts as one of the salivary buffers and it cannot exist in solution at physiological pH except in very minute concentration. Hence, if the saliva is not saturated with phosphate, tendency for enamel dissolution and release of phosphate ions into the saliva increases. And thus there was inverse relation between the salivary phosphate and the caries. So calcium and phosphate together influence the driving force for the precipitation or dissolution of calcium hydroxyapatite. It has a key role in post-eruptive maturation of enamel. It facilitates the remineralization of incipient carious lesions. So correlation between the dental caries, alkaline phosphatase and calcium levels by Mitra et al. Has mentioned that calcium levels were decreased in patients with caries and found with a significant correlation between alkaline phosphatase and calcium levels and hence can be used as a biochemical indicator in evaluating the caries susceptibility. Coming to the discussion of IgA, Lehner et al. Has found that the caries-prone individuals had lower IgA and was in accordance to our study. Here, the IgA antibodies in saliva correlated with the lower level of caries because the IgA antibodies inhibited the adherence and colonization of Streptococcus mutans. Camden et al. Also has mentioned that the degree of caries activity and total IgA concentration and DMFTs were negatively correlated. De Silva et al. Mentioned that the increase in the IgA level in caries group as compared to caries-free group. Doikuda et al. Whereas mentioned that the higher levels of IgA were related to the reduction in the dental caries. Okay, the association between salivary IgA concentration and dental caries and updated meta-analysis by Zhu et al. Also mentioned that a negative correlation exists between the caries activity and IgA. The salivary flow rate was compared in the Kessler et al., who mentioned that the rampant caries because of the reduced salivary flow. Shelby et al. Mentioned the increase in the cervical caries and atresion and staining because of the reduction in the salivary flow rate. Whereas Dow et al. Has mentioned increased flow rate leads to increased concentration of protein, sodium chloride, and bicarbonate. Thus, the decrease in the mean salivary flow rate, pH, and buffering capacity leads to the decrease in the caries. Whereas mean salivary viscosity has found a higher caries. The environmental tobacco smoke by affecting the vitamin C level leads to the growth of bacterial colonies, and tobacco chewing, continuous chewing will lead to the enlargement and inflammation and hence xerostomia, and together leads to the dental caries. The study by Maheshwari et al. Found that the saliva calcium and total antioxidants level were higher in caries active group, but no correlation was reported in the caries activity flow rate of the saliva. Coming to the conclusion, saliva can significantly impact dental caries diagnostic for future use. The intergroup comparison using t-test for alpha amylase, phosphates, IgA, pH, flow rate, protein among the dental caries group, the difference was statistically highly significant except for the calcium. The multifactorial dental caries also are associated with the poor oral hygiene. This study evaluated the role played by host protective factors, that is saliva, which can target the preventive measures appropriately for useful and accurate measurements of dental caries because prevention is always better than cure. Coming to the future's implications, the future studies for the salivary constituents with the inclusion of tobacco frequency and type can be categorized with the further grades of DMFT. Also, IgA levels can be compared with the Streptococcus. These are my references. Thank you for the patient listening. Thank you.